Cholesterol in our bodies comes from two places. The first place is from our liver, and that is important because a certain amount of cholesterol is needed for a healthy life, and our liver makes that. The second place that we get cholesterol from is from our diet, and that is from animal products, so things like meat, poultry, and full-fat dairy. The other thing that I always want to remind my patients is that when you eat a diet that's high in saturated fat and trans fats, your liver actually produces more cholesterol. So it tends to be a cycle. When you eat foods that are high in fat, your liver likes to really try and produce more cholesterol. It's important to get a lipid profile checked because we don't feel our high cholesterol, and it is a major risk factor for the development of cardiovascular disease like heart attacks and strokes. And the only way to know your risk is to get your numbers checked. A lipid profile is a blood test that a person can get checked at their doctor's office. Primarily, this is done as a fasting type of blood test, and when you get your lipid profile back, you're going to see 4 numbers. The first number that you'll see is your total cholesterol. An ideal number for this should be less than about 200. The next number that you'll see will be your triglycerides. This is another type of cholesterol that we can check for in the blood, and this primarily tells us about the fat content in the blood. An ideal number for triglycerides is less than 150. The third number that you'll see will be your HDL. This is commonly referred to as your good cholesterol. HDL, this number should be as high as possible, so anything over 50 is great. The last number that a person would see would be their LDL. This is oftentimes referred to as your bad cholesterol. The goal number for your LDL is going to depend on your personal risk factors for current cardiovascular disease or your likelihood of developing cardiovascular disease. In general, for the average person, less than 130 is reasonable, but in some patients, for example, those that have had heart attacks or strokes, we may say we want your goal to be less than 100, and in some patients even less than 70. If your lipid profile shows that you have high cholesterol, the first thing that you and your doctor will probably talk about will be diet and exercise. However, for some patients, that's not always enough, and if that's not enough, then you may have to think about medication. The U.S. Preventative Services Task Force and the American Heart Association and the American College of Cardiology recommend that adults start getting their lipid profile checked around the age of 20. The next time that you'll need to get it checked is really going to depend on your personal risk factors. If you're really young and your numbers look great, your physician may say you can wait a couple years. If you're a little bit older and you have other diseases like diabetes, chronic kidney disease, or high blood pressure, or if you've already had a heart attack or a stroke, your physician may suggest that you get this checked about once a year, maybe even sooner than that for some patients.